Hi, I'm Hannah Norton, a Reference and Liaison Librarian at the University of Florida Health Science Center Libraries. This video is the first in a four-part series that addresses formulating a clinical question and developing tactics for an optimized literature search. This video addresses forming and refining the search question. Spending time thinking about the question before you start doing your literature search is important because a well-defined search makes it easier to find the research that best addresses your concerns. A useful memory aid for asking these questions is PICO, where P is the patient, population, or problem, I is the intervention or treatment, C is the comparison or control, and O is the outcome. In general, the patient or population or problem would be defined by the concern, disease or health status, as well as relevant factors such as age, race, sex, medications, or other health history. Next, determine the intervention, which can be the treatment you are interested in, or a specific diagnostic test or form of screening. The next step is comparison. You could be comparing your intervention to an alternative that could be the standard of care, a different treatment, no treatment, or a placebo. Depending on your question, you might not need to include a comparison. The fourth step is the outcome you are investigating, or the desired result. This could be improving function, maintaining health, improving health, alleviating discomfort, preventing premature death, or other measures. Let's work through an example of the process by formulating a question from a clinical scenario. So for example, you're seeing a 31-year-old patient in your clinic who has discovered a lump in her breast. After a biopsy, the lump tests positive for cancer. Your patient is 18 weeks pregnant, and you wonder what treatment option — you're considering chemotherapy, surgery followed by chemotherapy, or surgery followed by radiation therapy — is optimal for successfully treating the mother while caring for the fetus's health and development. Think about words or phrases that could capture the topic. In this case, the patient or population is pregnant women with breast cancer. Our intervention to study is chemotherapy. Our comparison is surgery followed by radiation therapy, and potential outcomes are maintaining maternal health, preventing birth defects, and optimizing fetal health. Once you've identified the terms, you can put them into the form of a question. In this case, in pregnant breast cancer patients, does chemotherapy compare favorably to surgery with radiation therapy in improving health outcomes for a mother and baby? Developing questions in this way is key to achieving a focused set of search results. And that concludes our presentation on PICO questions. If you have any questions, don't hesitate to email or call the library or to contact your liaison librarian directly. We'd be happy to help you become a better searcher. You can also use our guide, UF Information Resources for Medical Students, to find this and other videos on literature searches and lots of other resources that are available through UF's Health Science Center libraries. Please stay tuned for Controlled Vocabularies, Part 2 of this Finding the Evidence video series.